Hello, I'm Stephen Jarrett. This is Iku Akamoto, and today we'll be doing the neurodynamic mobilization badge for upper extremity and lower extremity. For upper extremity, what we've learned thus far and what's shown in the book are for radial, ulnar, and median nerve, and we'll perform all three. We'll assess where he has a restriction, take him to that point, and then floss at that point, and then reassess. So first thing we will do is for the median nerve. I will have my patient in a scapular depression, so push down on the scapula. Median nerve, I'll abduct the shoulder to about 90. I'll externally rotate. I'll have him fingers extended. So like we said, scapular depression, 90 degrees abduction, elbow extension, elbow supination, and finger extension. And do you feel any restrictions here?
Yeah, right.
Where at? If I back off on the mic?
This way.
Okay, we found a restriction here. I'll start to, may I have you bend your head towards that way? Yep. Also at the neck into there.
Oh.
And I'll just kind of move the structures that I'm dealing with in order to floss the nerve in between those structures. Good. Still feel the same tingling or anything?
Little bit, but it's getting better.
Okay. As we can see, maybe in that one session, we treat the adhesions or problems that we're dealing with, but you do start to get the benefits over time. Next thing we will do is for the radial nerve. Exact opposite of how I have them now. Still be in scapular depression. Still 90 degrees abduction. This time I'll have him internally rotated with fingers flexed. And I'll add a degree of ulnar deviation in there. Actually, radial deviation, I apologize. You feel any restrictions here?
I feel like a little bit numbness.
Numbness, okay. So we can start to floss here, depress, and flex with the fingers. Keep the elbow nice and extended. You can literally a joint mode, but for a nerve. Good. Still the same symptoms?
Yeah, but a little bit same thing. It's getting better.
Same result with the patient, just decreased sensitivity, you could say. Last thing that we'll do for upper extremity is the ulnar nerve. Ulnar nerve position is similar to what you see from a shot putter. May I have you, there is no no scapular depression for this one. He will be in elbow flexion. Can you bend your head that way? Good. He will be in forearm supination, and then extension of the fingers. You feel any restrictions here?
Nothing.
Okay, nothing in this patient. Let's try to take him into some more extension of the fingers, possibly. Anything here?
No.
Good, good. So not really many restrictions for this patient. But in the event that he did, I would floss the area that I'm at until symptoms subside or get worse, which we wouldn't want. That would also cause you to stop. In our text, if I'm incorrect, then I assume I'll fail this badge, but the mobilization for lower extremity that I saw was for sciatic nerve. It included, good. It's kind of like a slump test if you were looking for a discogenic pathology, but I'll have my patient, I'm looking for sciatic nerve, which comes down. It obviously branches off to innervation for the lower extremity, but that's our thick cord that if that's impaired, then the rest of the lower extremity will be impaired. So for that big guy, which happens to be the thickest nerve in the body, we'll go into about 90 degrees hip flexion, not as much here, and then we'll also go into dorsiflexion. dorsiflexion here, and then I'll also have my patient bring his head up to do a 10 chuck. Good. And if he has problems at that point, I'd relax the leg, have him bend his head back down to the floor. Good. And then floss the same motion again. Head back up, 90 degrees, dorsiflexion. And go back down. And then right back up, head flex, 90 degrees, and dorsiflexion. And floss there. That would conclude the neurodynamic badge.